What am I doing in my job?
Yeah.
Well, I'm currently wheelchair service manager. So I've been doing it for a ridiculous amount of time.
How many years?
Since, I'm going to let you work that out, since 1995, 1st of January 1995.
So what did you do before then?
What did I do before? Well, before that I was at Royal Shrewsbury Hospital doing outreach work as OT. And then before that, because there's before that as well, I was in social services for Shropshire, working for the local authority in Shropshire, in Shrewsbury. And then before that, I was in Telford Social Services. Before that, I was in Wolverhampton, when we first moved down from Yorkshire, at the Royal Hospital, which no longer exists. It's now pulled down. The only OT there came down from Yorkshire. But prior to that, which was probably the best job I ever had, was working in a private hospital run by monks. And before that, I was at Darlington Memorial Hospital doing neuro, and before that I was mental health.
Wow, Chris.
Oh. And so you can all try and work out how many years all that was.
So what made you go? Because obviously you went into wheelchair services in '95.
Yeah.
So then what's made you stay that long?
Well, yeah, that's a good question.
I mean, it is, because I've done wheelchairs, so it is interesting, isn't it? It's you've done wheelchairs as well, haven't you?
Oh, have you done wheelchairs? I didn't know that.
Yeah.
Oh, where was that?
For about 4 years, Buckinghamshire.
Oh, right, yeah. I think it's just the variety. I think every time, I mean, I have to confess, there's times when you think, oh no, there must be a different life than this. Why? And then feeling guilty about sticking in the same job, but then reminding myself that actually I have had, all of what happened before has led me to doing this. Yeah. And I think it's more variety than anything I've ever been in. You never, we always know that OT, you never quite know what's going to happen. But with wheelchairs, you really don't know what's. And you can have a 2-year-old in clinic in the morning and a 90-year-old in the afternoon.
That's what's nice though, isn't it? Because it's got that complete spread.
Yeah.
So you've almost got a bit of everything.
Yeah. And that's, I think, and the team, the fact that you're dealing with equipment, it's clinical, it's equipment. You've got a team of admin and the stores and repairs, so there's a lot to. It's like 3 teams in one, and and I sort of coordinate all that, and also insist on keeping my clinical hand in as well. So I kind of
I enjoyed getting the tool kit as well.
Yeah,
toolbox.
Yeah,
it was very OT thing.
Yeah, there's a
But I used to have a pink one just so that our technician wouldn't nick off.
Oh right, tools. Yeah.
But yeah.
So what led you to CNRT then?
Well, I was born in Shropshire, so a little bit of it is, actually you only appreciate, don't you, when you're away, how lovely where you grew up actually was. Well, not that Buckinghamshire was where I worked for over 10 years, and that's where I worked with the wheelchair service. Right. But yeah, I guess, yes, coming home and I got married and had children, and hence sort of coming into a neuro role in Shropshire really. Yeah. But yeah, I did work in Buckinghamshire from a community neuro point of view, in a little rehab unit, and that for me was my best job because it was a really good rehab team. We had music therapists, we had lots of clinical psychologists, so you worked with a real range of clinicians, never mind individuals as well. And that sort of led me into I fancied a bit of a change, so went into wheelchairs. I was in wheelchair service for about 4 years. And then kind of started to miss a bit of the hands-on clinical a bit more. And then came back to sort of neuro rehab in Bucks, and then came back to, say, Shropshire. But
it's interesting how we've all got slightly different career paths, haven't we? But we start with the same. Well, obviously you're physio, but when the 3 of us are OTs, but we started with that basic. And then you move on.
I think a rotation is really important though.
I was going to say, that's how from a rotational point of view, because I started at Wrexham in Minor Hospital in Wales as a rotational physio. And again, it's that you meet inspirational sort of clinicians, don't you? There was a The neuro rehab physio there was brilliant, absolutely brilliant. So kind of got me involved and really
I think it's a good way as well of just sort of seeing what area you fancy, because I think
it gives you a
when
taster, doesn't
yeah,
it?
and when you're going through your training, you have your placements, but they tend to just happen to be where they are. I don't remember having an awful lot of choice in that, whether that's changed now. But you know, you were sort of put where you were put. So I think the rotation gives you that opportunity to just see what areas you enjoy. Because it is so diverse, and there's so many areas that you can go into that are so different.
I think as well, though, with the rotation, it makes you see different areas. So even if you don't work in those areas,
You've just got that.
you've got that bit of knowledge about how they work.
Absolutely.
Because I think that's one of the issues that when I worked in wheelchair service, we used to feel that because they didn't necessarily at the time offer students and there was no rotation into that wheelchair service, I always used to feel that people didn't understand what our role was within a wheelchair service. And I used to say, you know, we really need to get a rotation in that comes through the wheelchair service, because people need to understand it.
Yeah, it is a service that people, even the OT college doesn't really give it an awful lot of airtime. And I'm sure also physio probably doesn't give it an awful lot of it, because obviously we have physios and OTs that work in wheelchair services, and rehabilitation engineers. And I also think the role that you do, Lisa, you know, with with CES is so valuable. You know, because that equipment side, it's that specialism, isn't it, into that knowledge of that.
Yeah, see, I've only ever worked community, so I've never worked in a hospital other than placement.
Oh, really?
Yeah, but my very first placement was very equipment based, and from there, I don't know why it was, I just saw, I think that such a small piece of equipment could make such a difference. So yes, the rehab and everything makes a difference as well, but I just saw that sometimes it can just be the simplest of things. So I mean, when I trained, we used to give out stuff like kettle tippers and that sort of stuff, but that would be the difference between somebody being able to make their own hot drink and not. And it was like, in actual fact, no number of rehab is going to help with that, because it's just a weakness. So you're not going to get that strength necessarily back, but that piece of equipment meant that actually for a few more years you can do that yourself. So I think I sort of saw that side of it. So I've always had that interest, and then sort of eventually ended up where I am. So.
I must admit, this is an interesting thing to do, because you kind of reflect on your career, don't you? And actually, if it hadn't been for doing the OT training, I wouldn't have had all those experiences, and I wouldn't have ended up here. So I have to say that I kind of think, you know, if anybody was to say to me, you know, what job should, you know, I'd quite like to go into the caring profession, I'd have to push OT, because you can go into so many different avenues. I mean, look at the three of us, you know, and we can do, you know, and what backgrounds we've had.
Well, it's interesting, because I originally, you know, when people are sort of saying to you at 16, 17, what do you want to do, you know, and I wanted to go into sort of nursing. But I think some of it is I knew I wanted a health profession, but didn't really know about much else. And it was a friend of my mum's who worked at a clinic, and she was a health visitor and worked with, so they had OTs based there, and it was her that said to me, have you thought about OT? I hadn't got a clue what it was, and I went and spent a couple of days with their OT, and that was it then, that was the training I was going down, so I applied for the courses.
I was a bit the same. My mum used to work in a physio department, she was a physio assistant. I went to a hand injury clinic, and I just remember coming out and watching the splints being made, and I thought, I want to be an OT. And and I did do hand injuries for a bit. I really enjoyed it. And then I just went, I did a rotation. I did like a senior 2 rotation.
And Vicky, what do you like best?
What do I like best about my role? My current role? Well, I suppose the reason I came into CNRT, I'd done wheelchair services for about 4 years, and it was up in Runcorn, and I live in Shrewsbury, so it was quite a trek. So there was an element of work-life balance, because it's like 3 miles away, and I enjoy running, and so I can run into work and that sort of thing sometimes. but also I was a bit like you. I wanted to do something different when I went into wheelchair services. Really enjoyed that. Found I was using quite a lot of my neuro knowledge because we see quite a lot of neuro patients, but then also got slightly itchy hands that I wanted to use my neuro skills again. And it's so varied, isn't it? The clients that we get are so varied in their neurological presentation, and it's really nice to be able to sort of use my hands-on skills doing upper limb treatment, but also like all the cognitive side of it, visual perceptual side of it, the assessments that we use, getting out into people's homes and seeing them, how they actually manage in their home, and like, you know, tying in all the equipment as well is really, really useful, and seeing how that equipment can keep them active and independent.
And I think it's nice as well because also the other sort of agencies and stuff that you kind of work with, so voluntary, so, you know, and also for me, I enjoy things like the sort of assisting clients sort of returning to gym or activities or whatever that might be.
And seeing them go back to work as well.
Yeah.
So you are a little bit of an OT then, really.
Yeah,
there's
There's a little bit there.
I think there's always
There's
an element
definitely
within
an area for
neuro,
that.
and I think
'Cause you work as a
wherever you
team.
work in neuro, because you have to work so closely as a team, there is an element. I mean, my friend who's a physio, she will always say that I've got one blue leg, and I'll always say that she's got one green leg. And I think there is an element of that when you're in
Turquoise
neuro.
working.
Turquoise
that's
working.
right.
Yeah,
That needs to be the new uniform
I've heard
colour.
that being used.
But there's always that overlapping, isn't there, you know, of the roles. But I think, like you say, they complement each other, and that, I think, brings that holistic approach to the patient.
To the patient, the individual, isn't it? That's what it's about.
Yeah. So I worked in intermediate care. I was there for 9 years. And so that was sort of like your rehab based, out in the community, out in people's homes. And that served me well. I really enjoyed it. And that was great. Sort of, I was having children and maternity leave and stuff like that. So it was quite a nice job that I sort of got the hang of and I could just plod along at. So for the time I did it, I thoroughly enjoyed it. But when this job came up 2 years ago, I just sort of thought, you know what, I'm ready for that new challenge, ready for something different. And I think sort of going into the role I'm in, I'd got quite a good knowledge of the basic equipment. The more specialist stuff is what has fascinated me because there's so much out there. There's so many different options, and sort of like through doing panel and that. I mean, there's times that stuff comes through and I just think, I've got a clue what that is. You know, I'll go and have a look at it and look into it. So there's always, I think for me, I enjoy what I do because there's always that element of learning. There's always something new. And just when you think you're getting the hang of it, they bring something new to the market. But there's always some development happening, which is really good. I like that side of it. I'm sort of...
You must love going to the OT show.
Oh, absolutely. I'm in my element there.
Because we, you know, obviously specialise in wheelchairs and the seating so much, but we still have to get involved with hoisting and slings and other periphery, you know, whatever we do has to be functional within the space and within the other equipment that's available. It's really useful to sort of gen up again.
I think again it shows how those sort of roles though impact on each other, doesn't it? Because the equipment that we provide impacts on the equipment you provide, vice versa. The rehab you give impacts on the equipment they might need. So it's how all that sort of ties in together, isn't it? And how the services almost help that, again, that one patient.
Yeah, I mean, I love the team that I'm with anyway, but I think just thinking about today, and we've got specialised orthotic services in, is when you see a patient come in who is, and we do see some very, very distorted physical presentations, and they're sitting in something, you know, their sitting position is dreadful, and then you get them moulded, and then the following month they go home, and just the fact that you can see the relief on their faces, even if they're not communicating, you can, and it is just such a visual, you know, indication
Feedback.
of you've done a good job. A little thank you is really nice as well, isn't it? That's one of the best things. Well, you only need a thank you once a week, and it keeps you going.
Yeah, that's true.
Yeah.
So you retired and then came back. What
I
made you
did.
decide to do that?
Yes, yeah. I thought, well, I'll give it a month. I'll see how I feel. I kind of knew before I even put my retirement in that I'm not sure that I'm ready for this. I think it was mostly peer pressure, because I have probably out of my year group who I trained with, I am the last person that is working full time. I just enjoy it, and I think, and I thought I'll give it a month and see. Don't plan anything, just pretend you've got, you're unemployed. That's how I felt. I've never been unemployed in my life. But it was wonderful. It was lovely coming back. I really, really, I don't know. I can't put it into words. Maybe it's just part of me after all these years that it's very, very difficult to let go.
Yeah.
But the fact that I could come back made it easier to retire, if that makes sense.
So it's nice having that option, isn't it?
Yeah. So I could get that, because of course you've got to think about your finances. You could get that finance sort of like set in place, but also know that you're still contributing.
Yeah, because I keep thinking in a few years' time I'd quite like to take early retirement, but do the same thing really. Probably come back, perhaps reduced hours, but still. Because it is a role, isn't it?
It is a role,
and I still want to do something, but not necessarily full time.
No,
I
must admit, a year later, because it now is a full year that I've done this, I am now considering about sort of reducing hours and seeing how that can work. But again, I think the trust is quite good in having that conversation, because it's not a clear cut-off. Because again, if you sort of turn the tables, I'm kind of like the patient, if you like now. I need to be slowly moved out of this particular role into another role, and I have to do OT on myself to be able to do that. So I don't feel like you've got to make that final decision and that's it. I
feel as if though we've got a lot of life skills and professional skills that we can.
Yeah.
I still feel I want to pass that on. I enjoy having students because I enjoy teaching. I enjoy, I did some lecturing before at Worcester and I really enjoyed it. Yeah. Enjoy passing on that knowledge.
Yeah.
Their conference is coming up in June, so I'll be going to that, and they have meetings sort of every other month, which I sort of join in. So I suppose because I'm an AHP on my own, I don't really have that supervision. So I suppose I sort of get it through other routes. So I get it through that because I link in with a load of other AHPs who are in a very similar role. Because there's only one of me in Shropshire, there's only one in each or a couple in each county, so it's actually quite a specialist role. So I think I tend to get it through that, and then through sort of like the AHP forums and that we do within Shropcom, rather than sort of, when I was in my previous role, it was more your structured supervision of go through your patients, how are you getting on, what do you need to do? What would be your best bit of advice for others who are thinking of going into this career?
I think it's really important to probably try and do some work experience, but perhaps do it in different areas. So not necessarily just go into a hospital, because I think people always think of therapists as being in hospital and forget that we work in the community, and actually I think probably we do a lot more diversity within the community. So I think it's really important to probably go and spend some time.
I would just say take every opportunity.
Yeah,
and if you've got an opportunity, even if that's just to go and spend a day with another team, as you rightly said, that insight into what that team does can help with your sort of career progression and just...
And if you think about it, you went into OT because of a friend of your mum's. I went into OT because of my mum trying to push me into physio, but didn't want to do it. I wanted to do OT instead. But it is sometimes those
and sometimes it is literally just knowing what's out there, isn't it?
And also sort of broader than that, I would say, because I worked in an old people's home as a carer for a sort of holiday job, and again it just gives you a little bit of a taster of the care system generally. And I think actually the experience of doing that further sort of fueled that, oh, actually I do want to do something within sort of care role, but you just are open to all the multi-pathologies, all the various individuals who are involved with the care of, or in that case, elderly people. But yeah,
People
so you
tend
don't have to, because it's sometimes I think it is quite difficult to get into, you know, with into various
I think as well,
services maybe, but
there's
broader.
quite a lot of therapists that will come from,
Yeah.
well, like with the assistant that you had,
Yes,
went
yeah.
off to go and train
Yeah, yeah.
because they'd
'Cause
worked as an
yeah,
assistant.
That's right.
And I certainly
That
know quite a
happens a lot,
few.
yeah.
And I
Yeah.
know
Certainly,
I've
that's
met
happened a lot.
assistants that I just think, oh my God, you would be a really good OT.
Yeah, yeah.
You know,
Mm.
and I think that's quite a good route as well, isn't it?
It is, yeah.
I think as well it's realising that there are different routes to it. So like I finished school, went straight to university and did it that way. Other people have had other jobs first and then realised. So I know one of the social services guys, he was in the RAF and then, you know,
Yeah.
then went into OT. There's, like you say, there's sort of your assistants that then become OTs or physios or whatever route they go. So I think it's sort of realising that there's lots of route to market. It's not just one
We've got
way.
an assistant practitioner.
Absolutely.
His background is he was in the Royal Air Force,
Sorry,
and then he was a prison guard, wasn't he,
Yeah.
at Shrewsbury Prison?
It's those transferable skills.
Yeah.
Ultimately, it's about what is it to be a therapist? What's it about?
And there are a lot of transferable skills and a lot of transferable skills between areas. So I think that some people almost get into an area and think that that's perhaps where they're, I don't want to say stuck, but almost that's their career path. But actually there's a lot of those skills that can be used
Absolutely.
in a lot of areas.
Yeah.